think the report starts to become even more relevant as we started to write it, and it became even more so once it was published. The present challenges that we are facing nowadays makes our educational systems to ask to what extent they are preparing young people for the current challenges that they are facing. For example, of course, you can just mention how COVID brought about the relevance of mental health, well-being, and resilience into education, even before academic learning. We also have presently the conflict in Europe, the refugee flow, causing many psychosocial problems for those involved. We also have climate change, which is another big event influencing many young people all over the world, but also in particular in Europe. We had just had the first heat wave just even before summer has officially started. And then we have like climate, hate speech, online safety, cyberbullying, poverty, social inequality. So all these issues are going to influence the development of young people and needs to be addressed as well by education. Then I think another issue which makes the report highly relevant is the increase in mental health issues and challenges for young people and today. For example, depression, suicide. If we look at suicide, is the second leading cause of death of young people in Europe, and the first in countries with poor to medium socioeconomic status. And of course, anxiety levels, and COVID, for example, exacerbated anxiety levels and mental health issues, antisocial behavior, substance use, eating disorders. To just give you an example, 10 to 20% of children face some mental health issues during their school years. A recent study by the EU with UNICEF in 2021 with 10,000 children in Europe found that 1 in 5 children are not happy and they are anxious about their future. And they mentioned like bullying, coping with schoolwork, and loneliness as issues. And the third issue, reason why it is so relevant is the realization, the evidence base, which we are having from the literature, that school-based mental health can help to address some of these challenges, to bring about positive change, development in young people's lives, to build resilience, and to prevent the onset of mental health issues in adolescence. It's important to correct this, that schools are not mental health centers, they are not clinics, and teachers are not psychologists and mental health professionals. However, also we need to maybe define what we mean by mental health and well-being. So we are not necessarily talking about mental health conditions or disorders, but we are talking also primarily mental health promotion. So the promotion of well-being and positive development in young children, that they make maximize the potential that they have of their abilities and capacities, to have a positive self-identity, to be able to deal with the challenges of life that they are going to face, to build healthy relationships with others. So these are all important part of well-being and mental health, which we think all young children and young people should possess in order to lead happy, productive, and active citizenship in life. So if we focus on that, school can have and look at the education in a more broader agenda. School can have a very important role in preparing children and young people for adulthood in this way, preparing for the tests of life, not just academic learning. So as I said earlier, this brings about the shift in the way we see education. It's not just academic learning, but also well-being, social-emotional learning. And of course, related to that, schools are not going to do this alone, because we also found one of the findings of our study. So need to be build partnerships with experts, professionals, with the community, with parents, so that they can achieve this mission more effectively. Yeah, I mean, the report, we developed a framework and then a set of recommendations for policymakers, how they can put this into practice. And I think one of the main findings, implications of the study is the need for the member states, for educational authorities, and for schools to recognize the importance of well-being and mental health as a primary educational goal, as a priority area in education. I think this is a very important objective which we need to focus, that the mission statements of schools, that the curricula, the objectives of education needs to reflect this goal. So there needs to be this transformation of education. Of course, we made some suggestions how this could be put into practice through awareness, advocacy, and so on. Then another finding related, because we have kept in mind that as NESET, within the NESET mission goal, that we focus on the European context. Okay, and so we also found that we need to invest in curricula and program development on mental health promotion, which are culturally sensitive and relevant to the European context. And these include socio-emotional learning programs, resilience programs, sports and physical activities, extracurricular activities, nature-based inquiries, arts education. We mentioned in the report some good practices which are already taking place, a number of projects funded by the EU, especially Erasmus and Horizon. So the third point, I'm going very briefly, the research underlines the importance of mental health in terms of relationships, connectedness. This is the foundation, the heart of well-being and mental health. So we underlined, and COVID showed us this even more, the importance of schools to operate as more caring, nurturing, and safe environments, both in the classroom and within the whole school, promoting values such as connectedness, support, diversity and inclusion, prevention of bullying, solidarity. And then another point which we underline in the report, also evidence informed, is the need for a participatory bottom-up approach when schools are going to build this well-being project. Especially we paid particular attention to the voice of the students, that the students are involved as co-designers in this project. We talked also about the need, a very important part of the teacher training, that teachers need to have the skills and tools to do this, and also about their own well-being. And finally, we made this point that this is a big project. So schools, it's intersectoral, multidisciplinary. So schools cannot do it alone. They need to build partnerships. They have their expertise, but they need to build partnerships with the parents, the community, mental health professionals and services to provide both universal for all children and targeted interventions for students with mental health needs. I think this is a very important point because sometimes we take it for granted and it is not addressed properly. We cannot expect teachers to promote well-being and mental health if they themselves are not mentally healthy and enjoying well-being. And so that's the first point. And secondly, if they do not have the skills, the tools, how to do this in the classroom. So if they have been trained primarily in cognitive development, academic learning, they would need to have also the skills to understand children's socio-emotional development, how to regulate emotions, how they themselves, the teachers, can build relationships, how they can build inclusive classrooms. And also, the teachers need to have, we underline this, like a transformative education where they themselves, through the training, change and started to look at well-being and practice well-being themselves. So in that way, they become also very good role models. So we very much emphasize the need that before we start working with students, first, we need to prepare the adults and give them the tools so that they can support their students. So resilient teachers make for resilient kids, you know. So we provided a very comprehensive whole school approach. So this is the approach perspective which we proposed in the study, a holistic, whole school, systemic perspective, where the whole school community is participating and contributing to this project. And in this framework, it presents a sort of multi-layered roadmap, what they can do, which involves, as I said, the all school staff, starting from administration, but also to ancillary stuff, you know, catering and so on. The students taking active part in putting this vision into practice, the parents, the local community, and the mental health professionals. Also, there will be interventions at universal level in this framework. So, and this is the primary focus, like curricular approaches. So to prepare all children, not focus on those mental health needs, universal. So curriculum, classroom climate, whole school climate, working with parents, training staff, as well as there is targeted interventions for students who have additional needs together with professionals. We also, in this framework, we suggested a bottom-up participatory approach. So the school will develop, on the basis of this framework, will develop its own action plan, you know, which would be addressed according to its needs. So the first task would be for the school to establish a well-being team, which include representatives from administration, classroom teachers, students, parents, and the community. And together, they work together how to put this vision into practice. And we suggested, like, they do a needs analysis. Okay, what do we want to do at the school in terms to promote the well-being and mental health of all the community? Now, how are we going to do it? What are the mental health needs of our students? What resources do we already have, which we can make use of? What strengths do we have, like projects already, which we can incorporate and build on? And what challenges are there, and how can we overcome them? And before this starts being put into practice, coming back to a previous question, the adults in the school, especially teachers, but also parents, are provided with adequate training so that they can put this into practice. The idea is of this whole school approach is that this is a project for the whole school community. Everybody should be involved.